I think the next changes will be all fairly small incremental changes. So I think we will begin to learn the sociology, as it were, of why some people can't or won't take treatment, and improve treatments so that they can. So some of it will be side effects, and we can reduce side effects. Secondly, I think in the developing world, we're making great strides in providing care to a wider range of people. I think we need to actually think quite carefully how we manage those people. Is it possible to have them coming to a hospital, or would it be better for a lot more peer groups to be providing treatment and referring only those people who are difficult into some sort of central mechanism? There's a small chance, I think, that cure might be available in the future. I think the major problem I have is that the cure, all the things that are being done for cure at the moment are unbelievably expensive and are really not applicable to the third world. I'm a bit more hopeful about vaccines than I ever was, not in the next 5 years, but I think in the next 5 to 10 years, we are beginning to understand the correlates of protection. I'm a bit more hopeful than I was.
So HIV treatment is now highly effective. I think for anyone who takes their treatment properly or is able to take their treatment properly, you should be looking at 100% success rates. There will always be people who fail. We need to make sure in the future that the chances of failure is as small as possible. And that's not only about drugs, it's also about choosing the correct drugs, it's about the side effects of those drugs, and also about supporting individuals with HIV. We need to make sure that drugs become available for all, that their monitoring is available for all, and that we are able to have all the information necessary to make the correct choice. While we're waiting for that dream to happen, however, we have to really use the resources available to us. So the future is looking rosy. What we need to make sure is those patients are able to benefit from any advances in the future. And they are going to benefit from those advances from being there, being well, which means suppressing their virus fully by making the best choice of agents for them.